Okay, hi everyone, and welcome to this month's clinical case, which is on the condition of bronchiolitis. So, in a very similar format to the one we followed for the previous month's cases, I'll start off with a really quick introduction. We'll talk about some of the causes of bronchiolitis, some of the symptoms, some of the risk factors, and then we'll talk about how you would go about investigating this as a clinician, as well as what the best way to manage the condition is. Okay, so you might be wondering what bronchiolitis is. It's certainly not a particularly well heard of condition, at least not when you compare it to some of the more common conditions that people have heard of, like diabetes, for example. But what bronchiolitis effectively is it's a virus that infects some of the smallest airways in the lungs, and these airways are called bronchioles. So the virus infects these bronchioles, and what that causes is a lot of swelling in the airways, and that makes it difficult for air to flow into the lungs and out of the lungs because of the swelling and because of the kind of inflamed bronchioles there. And bronchiolitis is a condition that typically affects children under the age of 2 years. So really you're seeing this in a pediatric population. You're seeing this in very young children from the age from birth up until typically the age of 2 years. Okay, so as I said, the cause of bronchiolitis is viral, so it's a viral cause, and it's most commonly caused by a virus called the respiratory syncytial virus. The respiratory syncytial virus, and this is spread primarily via droplets in the air. So when another child, for example, with the condition coughs or sneezes, it can then sort of get into the body of another child and infect them. And there are many different risk factors for bronchiolitis. So I mentioned there that if you come into contact with many other children, you're much more likely to pick up this virus from them. But there are other risk factors as well. So if you have a weak immune system, if you were born prematurely, you're much more likely to develop the condition because you're not able to fight off the virus as effectively. And if you're growing up in a household where, say, the parents smoke, and there's a lot of tobacco smoke in the home, there's some evidence indicating that that's also a risk factor for developing bronchiolitis. So the symptoms of bronchiolitis, you can probably imagine what they are, given that it's a condition that involves an infection of the airways in the lungs, but it effectively causes coughing, wheezing, and shortness of breath. So children with this condition will find it difficult to breathe, again, because the airways are constricted. The airways that lead into the lungs are narrow, so air is not able to get in and out as efficiently. But it can also cause other symptoms, not just symptoms to do with the respiratory system, not just symptoms to do with the lungs, but it can also cause a fever, a generalized fever. It can cause a loss of appetite. So you will typically see these children come into, say, a GP practice, and they won't be eating as well. They'll be off their feeds. Okay, so a child's come in and you are thinking that they might potentially have bronchiolitis. How would you go about investigating it? The most important investigation is actually the one that I put on the bottom of this list here, and that investigation is just a simple clinical exam of the lungs using the stethoscope to listen to the lungs, to listen to the lung bases, to see what kind of sound the child is making when they are breathing, tapping along the lungs and seeing what kind of sound, whether it's hollow, whether it's dull. So doing a clinical exam of the lungs, which you will obviously learn about during your medical course, is one of the most important ways of sort of going about investigating, and a very simple way of investigating bronchiolitis. But you might also want to do other things. You might want to order a chest x-ray, and a chest x-ray could show you if there is anything inside the lungs, could show you if there's any other conditions that you want to exclude as well. And you'd also probably want to do some blood tests to see what the white blood cell count is, because that will show you whether or not there is an infection in the body that the immune system is responding to. Okay, so suppose you've got the test results back and you have diagnosed this child with bronchiolitis. How would you go about treating them? Well, it's very interesting to learn and to remember that very often, in the vast majority of cases, there will not be the need for any treatment. no treatment is really needed because most often the symptoms will resolve on their own. So most of the children who get bronchiolitis, so this respiratory syncytial virus infects their airways and they're having these symptoms, the symptoms will naturally go away on their own with time. So you just want to keep the child comfortable. You obviously want to prevent the child from spreading the infection to other people, to other children. But generally speaking, you won't need to have some targeted medical treatment. However, always with any condition, there can be less severe cases and more severe cases. And if a child becomes really unwell, in the really severe cases of bronchiolitis, you might need to admit them to hospital, and you might need to treat them with fluids. You might need to inject some fluids into their body because they'll be quite dehydrated. And obviously they're struggling to breathe, so you might also want to give them some oxygen. But as I said, this is only in the more severe cases because in the vast majority of cases, the symptoms will just naturally resolve and you won't need some specific treatment regime. Okay, and I would say the key takeaway from this case, so you'll recall that we typically end these cases by considering a key takeaway. I would say for this month's case, the key takeaway is to understand that some conditions are self-resolving and do not require specific intervention. So it's very common and natural to think that we are in medicine, and so we want to treat any condition the patient comes with. You want to throw some medicines at them, or you want to do a surgery, or you want to intervene in some way. But it's also important to remember that you don't always need to do that, because some conditions will just naturally get better, and you just want to support the patient and explain that to the patient. You don't always need to throw a whole bunch of medicines at them in order for the problem to resolve. Okay, and that wraps up this month's clinical case. Quite a short clinical case, but hopefully you've found it interesting and you've learned a little bit about a condition that perhaps you didn't know about before. And I look forward to presenting next month's case as well. So until then, hope you have a good month, and thanks for listening. Bye-bye.